In the last year, some important studies are published about treatment of dyslipidemia. What is the news?
Well, I think we now are beginning to understand that the PCSK9 inhibitors can reduce LDL cholesterol substantially, and we're beginning to see that there is an actual benefit in terms of reduced endpoints without any apparent increase in risk, as far as we know.
In your lecture, you say that there are many open questions about these studies. What are these questions?
Well, I think the data for the PCSK9 inhibitors are fairly clear. The data on the CANTOS trial, which is about reducing inflammation, was a little bit more difficult to understand. There were some side effects. The effect was quite small. The drug is very expensive, and I think we need to know more about treating inflammation before we make any changes to the guidelines. And then, of course, there was the PURE study, which was, again, quite difficult to interpret, but my own feeling is that does not change our current nutritional recommendations appreciably.
It's time to rethink our LDL goals.
Well, that is the discussion at the moment. Probably before we rush into it, we might like to see a little bit more endpoint data, but it's beginning to look as if a goal of 1.8 millimoles for high-risk people is a bit conservative.